Discussing intimacy, sexual boundaries, or past trauma is difficult. In many clinical settings, the pressure to find the right words and articulate these experiences often leads to complete silence rather than discovery. To address this, sex therapist Ronnie Burke developed a series of therapeutic cards, including the Let's Talk About Sex deck. This tool moves away from verbal interrogation, relying instead on a system of visual metaphors. This guide will demonstrate how to facilitate this process. We will cover the specific steps to guide individuals, couples, or groups through these visual prompts to maintain a safe and productive environment. These breakthroughs do not require a complex clinical setup. To begin, you only need the deck itself and a quiet space with a flat surface. Start by preparing the environment. Ask the client to take the cards and spread them across a table so every image is visible at once. Images like this figure with a finger to their lips provide a nonverbal entry point. By focusing on the art, clients bypass the anxiety of naming a taboo subject directly. Relationship distress or performance anxiety, topics that are often hard to initiate, become accessible when the client can point to a specific scene, like this man sitting on a bed, and describe what they see. Use these intake warm-up prompts to begin. Ask the client, "Which card catches your eye today?" Or, "What do you imagine the person in this picture is feeling?" This warm-up shifts the focus from the client's internal vocabulary to the external image. By discussing the figure in the picture, the client can establish a sense of safety before sharing their own story. Once engaged, introduce the sorting exercise. Divide the cards into 3 categories. First, connection, cards prompting a "this is me" reaction. Second, hesitation, cards raising a conflict, making them feel "I'm not sure." Finally, reaction, cards prompting a clear "this is really not me" response. Instruct the client to physically take all the rejection cards and return them to the box. This act clears the workspace and limits the focus to the specific themes relevant to the session. With only the connection and hesitation cards remaining, transition into a guided discussion. Use open-ended questions to explore choices, asking, "Why did you choose this card?" Or, "Are the feelings comfortable or difficult?" This sorting mechanism transforms a broad, complex subject into a manageable roadmap. It provides the session with a structure driven by the client's visual associations. This framework is also effective for interpersonal dynamics. In couples therapy, these images can reveal needs that have gone unexpressed. During a session, ask each partner to select a card that shows something missing in the relationship or a desire they haven't yet put into words. Using these images helps partners communicate through a proxy. It increases empathy and reduces the immediate tension that often blocks direct conversation. For group work, the cards provide a way to break the ice in communities where sex is not openly discussed. You can use thematic sharing by asking the group to discuss cards representing broad concepts like consent or pleasure. This allows the group to explore these topics collectively before moving to individual experiences. In both settings, the cards act as a buffer. They absorb the conflict and tension, allowing for a level of honesty that verbal dialogue alone might not sustain. If a client feels their experience is not represented in the deck, utilize the blank card. Encourage the client to add their own narrative by drawing an image or an emotion that is missing. This ensures the deck adapts to their specific world. The most important rule of facilitation is to let the client lead. Your role is not to interpret the art, but to listen to what the client sees in it. Be patient with the process. Respect the silences in the room. Visual processing takes time, and the client may need a moment to connect a specific image to a feeling. Remember that this exercise is a trigger for dialogue, not a diagnostic test. It is a way to start a conversation, not a method for clinical assessment. By acting as a guide rather than an interpreter, you ensure the client remains in control of their own narrative and the pace of the session. Look at this illustration of the man carrying a complex burden. This visual framework provides a clear system to navigate conversations about intimacy and identity, allowing clients to present their experiences directly instead of searching for the perfect vocabulary. To begin using this method, try the warm-up prompt in your next session. It is an immediate way to lower the pressure and start a dialogue. You can find these tools at Ronnie Burke's website, including the Let's Talk About Sex deck and the Free to Be Me set, designed for the LGBTQ+ community. Removing the demand for verbal precision changes the dynamic in the room. You give clients the agency to communicate through imagery, allowing the therapeutic process to move forward without the obstacle of unspoken words.